right, great. Thank you so much. It is such a privilege to be here today. I am Kim Sanchez, and I'm the Early Learning and K-12 Engagement Director for the agency. And I came to the agency I'm a career educator, I'm a licensed science teacher, and school administrator. And so it's been a privilege to be able to serve in this shared space between public health and schools. And I really appreciate everything that has been shared so far today. And Bailey, I love your coloring books, love it so much, and so appreciate that not only is your work engaging the adults who are wrapping around the children and youth in the area of schools, but also making your work and that educational piece visible to kids, which I just think is fantastic. And in addition to seeing that you have 2.5 FTE, that represents a big body of work, because engagement, in fact, does take quite a bit of time. But as I would tell my pre-service teachers when I was a mentor teacher, you know, the time spent in building those foundational relationships becomes that scaffolding on which the priorities we're trying to accomplish and the work that we're trying to do becomes possible. And so our approach at DOH really has been to really think about and shape how we interact with our partners. My work involves providing consultation and coaching and connections between people to ideas and to resources, and to really support how we strengthen our networks of relationships within our agency and with our school partners and early learning partners across agencies and at the local level and regional level, really to have a more cohesive approach to how we work with schools. Now, when I think about our history here at the agency, and I mean, super briefly, you know, prior to the needs and demands of the pandemic, there had been positions at DOH for liaisons, but really a key connector here at the agency is someone that many of you know, Nancy Bernard, and she was that really key connection between schools. And not to diminish any other connections between our programs with other spaces with schools, but much of our work was regulatory. And then during the pandemic, it really became visible the multiple intersections that not only DOH, but our local health jurisdictions, just the interactions that we would have and the complexities and considerations one would need to take in to figure out how could we keep kids in school and how might we maintain health and safety. I see that Dan can't hear anything. Can everyone else able to? Okay. I'll keep going. And then since then, the approach here at the agency has been these relationships and partnerships that we fostered out of need. We realized these relationships could really help forward broader shared priorities when it comes to our work with schools and to continue to do this work moving forward. And so one of the very first things that I did here at the agency was really identify all of our programs across the agency that intersect with the school space. This, what you see up on the screen is really just, that doesn't even represent all of the work, but that's quite a bit of work and highlights the importance of really being able to better understand who we're working with, how might we better support, how can we support our local health jurisdictional partners in supporting their schools. And so Bailey did an amazing job in talking about all their range of engagements. And I heard in other presentations today the importance of relationships and partnerships. And so really, I'm kind of taking the approach of looking at, you know, what are some lessons learned here at DOH, and really focus on why build these relationships, who are those some of the key partners that we have really benefited in our engagement and encouraged the ongoing relationships with, and really how to go about building those engagements. And so when we really think about the why, and I could hear it throughout much of the presentations today, is that really a key piece of building these relationships is thinking about making visible our biases and our unintended impacts. We may have a subject matter expertise in a particular area, but there is an element that we don't know how it will play out in another space. And so engaging with partners in multiple ways can help us better understand and be responsive to those needs. It allows us to collaborate, and as we have a change in our landscape on these shared priorities, we're able to leverage the strengths of where we sit. Local health jurisdictions and schools are knee deep in their communities, and so working together as a system of support allows us for a more cohesive approach and allows us to leverage our individual strengths. And just the range of thought partnership, which I'll talk a smidge more about a little bit later on just a more informed outcome and response. And so in thinking about our school partners, there are many. And so time does not allow us to talk about all of them, but I would love to share just a few partners who we at the Department of Health have really gained just a new or a renewed appreciation of how these partners can be very supportive to the work. And some of these partners have already been mentioned in some of the presentations today. So, we're keenly aware of our local health jurisdictions. And when I look at this map, in my head, I think about this map and kind of overlaying the two. And so within those local health jurisdictions, the map that you see on the screen is our student population in public education across the state of Washington and where that distribution is. So bigger the circle, the larger the school population. In the state of Washington, we have over 1.1 million students. And what's not represented on here, separate from the 295 school districts, the 2,200 school buildings, and those are just school buildings, not the number of actually buildings on a campus, but the number of elementary, middle, and high, as well as the charter schools. The education system we know is way bigger. I see Susie Hansen on the call, and so we have, I think, 81,000 students at least in the last year's head count that are in independent and private schools. And so the breadth of education across the state makes for to inform how we intersect and approach based on how do different rules and laws apply to different settings, what are the different needs based on size of schools, structure of schools, and so really appreciate and learn to appreciate just how complex these spaces can be. And so of the many key partners that we have really gained an appreciation of, and I know it's been mentioned previously today, is just that relationship with school nurses. And while in the pandemic, what came to light was just the awareness that many school nurses were the ones who were taking our guidance and implementing the COVID guidance. But broadly, beyond that, they are part of that bigger system of, as clinical professionals, working with their ESDs, working with healthcare authority on Medicaid reimbursement potentially, working with us in terms of other types of guidance documents that inform the school space, like the infectious disease control guide. And so school nurses, how we look at them as they are public health eyes, they may be the most consistent healthcare professional that children in the state of Washington see. We know that they are often shared between buildings, but they may be the ones that school administrators are looking to make decisions about, do we have recess based on outdoor air quality, or How might we, even if the outdoor air quality is okay for the majority of the students, how might we tend to the students who may have some chronic health conditions that don't allow them to go outside? And they may be first eyes on things like mental health concerns and kids who are chronically absent because of chronic illnesses or intersections with the building itself. So just really highlight that school nurses can and do inform how we can intersect and be more responsive in our work with schools. As a school administrator, I was a school administrator during the pandemic, and I became best friends, not really, but with the public health nurses at Clark County Public Health. I mean, I called them on a regular basis because I was responsible for these 550 littles and responsible to my staff and to the parents and to their community. And our connection with Clark County Public Health was so critical in helping me to figure out how to make decisions to support the continuity of learning and keep the health and keep the environment healthy and safe. So our school administrators, when we do listening sessions, say for example, if we're updating our air quality guidance, it's been really critical to have feedback from school nurses, school administrators, because again, they're going to be taking our guidance and looking at it through a lens of implementation. How do I implement this? What's the feasibility? What might be the challenges? How am I going to talk to my community about this? And so, as I spoke earlier about the idea of equity, each of these partners can help broaden our lens to better think about and end up with a better outcome that still honors that health and safety, but is more doable, accessible, feasible in a school space. Educational service districts have been brought up multiple times today, and they provide a range of services. Particularly when we think about a little less than half of the school districts in the state of Washington have less than 2,000 students. Each school district is required by law to maintain the same types of programming, but may not have the capacity for it. So educational service districts really are these service providers that can cooperatively provide assistance. And yes, I know we had mentioned, I think Bailey mentioned the risk management or risk advisors, and then, but educational service districts also have school health administrators. They have other programs that support their schools. And because of their regional work and support, they can be really key in sharing information, dispensing resources, and identifying maybe gaps, because they are the trusted partnership that has been there for an extensive period of time. So they're a great network to be able to link into. And I know many here are from local health jurisdictions, but if you are a school partner, I would say get to know your local health jurisdictions. You know, this was a need during the pandemic, but I would say this is an opportunity at every time, and every time is a good time to connect with your local health jurisdiction. There is a breadth of expertise and understanding and a willingness to connect. And I know from a state level, we know we are far away from the local level, and so honor and respect and want to support our local health jurisdictions as, again, a key partner in that work. So really appreciate just the range of partners in this space.
And Kim, we have all the 5 minutes left, so I'll let you keep going.
Oh, can you say that one more time here?
You have about 5 minutes left.
Goodness gracious, where does the time go?
I know.
So moving forward, how do we engage with these partners? I'm not going to go knee deep into this, but the main thing, you'll have these available in the slides. What I would just encourage you to think about is the how we engage exists on a spectrum, on a continuum, and it can look different for different needs and different outcomes. this has a lot of text on it, so I would just encourage you maybe to take a peek when you have free time to look at it. But really the key here is in terms of that arrow going across, we're really looking at, as the arrow moves across from left to right, the effort involved. It requires more time and effort. It is more of a democratic process as you go to the right. But that doesn't make it necessarily the best way. It really depends on what you're doing. And so what I would say, much like models of decision making, and is to be clear about in your communication. So what I mean by that is, if it is something where there isn't the opportunity to really collaborate and be responsive to that feedback, to be clear about that from the beginning, that we really we want to hear your feedback, but we are only going to be able to address these two things. And this is how we will let you know that we have responded to those two things. So the clarity is the key for how we engage, and how we make clear where and how engagement and what kind of engagement works for a given situation. So I'm going to skip that slide, but I would say, and I heard this in other presentations, really some of those engagement best practices is really that active listening, the empathetic expertise, and really asking oneself those questions, what is the impact of my work? Where are my blind spots? And that will help you to identify who are the partners you need to engage with, because they will be there to help you broaden your lens. So kind of wrapping all of that up, I guess the key thing that I would leave you with is that when is the best time to build relationships? Yesterday, which means you can do it today, and there's still time for tomorrow. And that cadence or the frequency with which you meet could certainly flex based on what the need is, because those relationships, if they are there, they're never too late to start. But if they are already there, then you already have the trust needed when you have to solve local problems. And in the solving, I would also say in the solving of local problems are the opportunities to build trust, which will then perpetuate your relationship. So much like any other relationship, it's something that needs a little bit of love, a little bit of time invested into it. But like a system, it's one that it can be strategically planned for and implemented. And we saw that in Bailey's presentation. So I don't know how much time really we have for questions. I'm happy to take if I can, or if not, if you do have questions, happy to put them in the chat or have further conversations about that. And then my contact information is in there as well. If you want to talk more partnership shop, happy to do so.
Kim, that's wonderful information, and we're so grateful that you were able to share that with this audience in particular. It's so relevant. We have so many different groups from so many different spaces here, so thank you. If anybody has questions, please feel free to put those in the chat, and Kim's going to be on for a little bit and can help respond to those. Great.